Welcome back to another episode of Homage Web Series. Today we have Shin Hwa, a dietitian from Homey, as our guest speaker. Shin Hwa has earned a Bachelor degree in Dietetics from Universiti Sains Malaysia and also a Master degree in Clinical Nutrition from the National University of Malaysia. So welcome and thank you for your time, Shin Hwa. Today the topic that we'll be covering is malnutrition in the elderly. So to start, first question. I think the word malnutrition is quite common, something that maybe we learn in school, right? But what actually is malnutrition, and is it common in seniors with dementia?
Thank you for the kind introductions. Hi, I'm Shin Hwa. So first and foremost, thank you, Homage, for inviting me to deliver this topic about malnutrition in the elderly. So as for the first questions, what is malnutrition? Actually, according to the Aspen and also Academy, malnutrition is actually defined as the presence of two or more of the following characteristics. The first one is the insufficient energy intake, weight loss, loss of muscle mass, loss of subcutaneous fat, localized or generalized fluid accumulations, and decreased functional status. Yeah, and actually malnutrition, they comes in two forms, which is the undernutrition and overnutrition. So undernutrition is actually is due to prolonged time of inadequate intake of energy and protein. And this is also maybe due to like some people, their body is having problem to absorb or use certain specific types of nutrients. So their body is breaking down the fats and also muscles for the fuel usage. So in contrast, the overnutrition is actually the result of overconsumption of energy in a prolonged time. Back to the questions, is malnutrition common among the elderly with dementia? The answer is yes. And undernutrition is actually very common among elderly with dementia, and it is actually a global issue because many elderly with dementia problems, they are actually having problems related to eating, such as swallowing and also chewing.
So what are the signs of malnutrition, especially those with dementia? Like what are the things that we need to look out to?
Okay, so how we spot the malnutrition, actually we are through the physicals. The first one is like they're having unintended weight loss, which we can see their clothes, dentures, belts, or jewelry become loose, or they are looking painless and lethargy. They are having the muscle wasting, especially in the temporal, canal muscle, or their leg, such as the femoral and calf muscles. They are having low mood. They are having loss of appetite. They show disinterest in their foods and also food intake. They are having loss of muscle strength and also poor wound healing. And when it comes to how we can measure whether they are having unintended or significant weight loss, when there's a decrease of 2% of weight in 1 month, or 5% in 3 months, or 10% in 6 months.
Wow.
So these are the signs we can spot and whether we can identify those elderly are in the risk of malnutrition.
Right. So just now you mentioned like loss of 2% of body weight, right, in a month, and then 3% and then 5%. How roughly 2% is like how many kg if you were to put it that way?
So the calculation is like using their baseline weight minus their current weight divided by their baseline weight. So we times 100%, so we can know actually how much percent of weight loss they can actually reduce.
Okay. So what are actually some of the contributing factors of malnutrition in seniors?
Actually, the factors that cause the malnutrition is multifactorial and is complex. So we can range from the physicals to social and also psychological problems. So among the elderly, a decrease in food intake is actually very common that cause them to put them at the malnourished state. So And at the same time, a decrease in food intake among the elderly is also related to their illness, whether it's acute or chronic, which put them at the increased needs. And besides that, the factors that will cause malnutrition is called as anorexia of aging is because the elderly is having lost the sense of smell and also the taste, which cause them to have the anorexia. So we call it anorexia of aging, which also lead them to be malnourished. And then polypharmacy, we call it as like the usage of more than 10 medications, and then the side effects of the medications. They are staying alone, they're having depressions. All these are the contributing factors of malnutrition in the elderly.
It's not only for dementia patient, right? It's also for a lot of the elderly in general out there that they are facing malnutrition because of environmental factor, because of their physical factor and all. So for people living with dementia, like you mentioned about loss of smell, loss of senses, right? How does this contribute to malnutrition specifically for dementia patients?
Okay, so for elderly living with dementia, they are actually having risk of malnutrition because they will actually have the loss of ability to recognize hunger or thirst. So they don't know that, as for normal people, we know when we are hungry, we will go for food, or if we are thirsty, we'll go for water. But they lost the ability of recognize this hunger or thirst. Second one is they lost the ability to know when and how to swallow or chew the food. And then they are also having difficulty in swallowing, so they cannot swallow the food and the food cannot enter and digested and becomes the nutrients for their body needs. And then they will also have the altered ability to recognize the object. So they will attempt to eat like inappropriate objects such as soups or flowers. And then people with dementia will also have the sight problems, which cause them to have misinterpreted the surrounding. So for them who are having the sight problems, they cannot differentiate whether it is food or fruit served in front of them. And besides of the senses, actually people with dementia, they are commonly having altered eating behavior. So there will be a change in their appetite, their food preference, and their eating behavior. So some of the people with dementia, they just want to eat the food they like. So this will lead to unbalanced diet intake because they just eat what they like. For example, only like sweet food or fatty food. So they are not taking the vegetables, fruits, which are high in vitamins and minerals. Some they will turn their head away when the carriage serves them the food, or they will just clamp their mouth closed when the food is served in front of them, or they just wandering around during the meal times, which cause them to have reduced nutrient intakes from the food.
Right.
So they are actually having risk of malnutrition.
So it is a gradual change, I would say. It depends on the severity of the dementia, right?
Yes, correct. Yeah.
Okay, so for people living with family member who has dementia or have a loved ones who is going through dementia, right? How can we prevent or even treat malnutrition in these seniors?
Okay, so routines. Okay, I can say that for the preventions of malnutrition, in routine screening with the validated tools is very important for the early preventions of malnutrition among the elderly. So, for example, malnutrition screening tools is commonly used among the elderly so that we can screen for their risk of malnutrition. So, for this screening tool, if the score is 2 and above, then they are actually at the risk of malnutrition. So, besides routine screening, we are also suggest to have early referral to the dietitians for an individualized and comprehensive nutritional care. And also, the third one is to identify and eliminate any potential causes of malnutrition, which we discussed before, the factors related to malnutrition, and also to avoid any unnecessary dietary restriction, Okay, so these are the preventive ways for the malnutrition in the elderly. So when it comes to management of malnutrition, so when elderly is identified positive in the screening test, so we will refer them to dietitians for a series of start from nutritional assessment, then we identify what the causes lead to the malnutrition, and then dietitian will do the intervention.
Okay. So in short, it's best to consult like a professional, like a doctor or dietitian, to basically monitor whether the dementia patient needs further dietary advice or any changes to their diets. So at what point, based on what you shared earlier, right, lost weight, loss of senses as well, but at what point should family members take note to proactively seek help from a professional like a dietitian or doctor?
So for the caregivers, they can observe from the physicals. Is there any significant weight loss? They observe. Is there any, for example, the muscle around the eye, they will be like loose depression, meaning that they are having fat loss among the elderly. Or when they pinch around the triceps, the finger they will meet. Or when they grab their leg muscle, they feel like there's a very little of the muscle.
Right,
or like besides from physical, we can observe from the dietary intake. Or is it they have reduced they have very significant reduce of intake for quite some time. For example, for like 7 days. Or are they experience any side effects from the medications? Yeah, like for example, having nausea or diarrhea causing them cannot eat properly. So these are the
signs to watch out to, right?
Yeah.
Okay, so I guess just to wrap this up, like for us, we all talk about prevention, right? So how can we improve our diet now to lower our risk of dementia?
Okay, so how can we improve our diet to lower the risk of dementia? Recently, there are many studies show that adherence to Mediterranean diet pattern is actually can significantly lower the risk of dementia. So what is Mediterranean diet? It is a diet characterized by a high intake of vegetables, fruits, unrefined cereals, nuts or olive oil, a moderate intake of fish, and low intake of dairy, big meat, or saturated fats. So this diet is actually high in omega-3 fatty acid, which already proven with having anti-inflammatory properties. They are also high in antioxidants, which can also ameliorate the age-related decline in the cognitive functions. So it will help to prevent it will help to delay the risk of dementia. The second one is their study also show that dementia is actually related to higher consumptions of like refined sugars and then high fat food.
So we have to cut sugar and cut oily food.
Try to cut out,
Yeah.
And then also excessive consumption intake of alcohol also will increase the risk of dementia. So keeping an active healthy lifestyle, having healthy diet, and also having active social also will help to reduce the risk of dementia.
I agree, like active social, it has a lot to do with your cognitive agility, strength, right? Anything to add on to that?
I think for the dietary intake, I would like to share some tips for caregivers, like for them to taking care of the elderly at the home. So actually we can like modify the food at home, like in terms of the food, we can like fortify the food. We increase the nutrient density in the food without adding the volume, because we know that poor appetite is one of the factors. It's very common among elderly, so they cannot tolerate with bulky food. So we will try to adding more nutrients in the original food without changing the volume. So for example, we will add some healthy oil or butter or cream or something like to make the food more nutrient dense. So without adding the volume, so the elderly also can take in more nutrients to increase their energy and protein intake. Or like, for example, during their meal times, we can add some finger foods. Yeah, we can also include their preference food, because when they are forcing the elderly to eat something they don't like, they will actually
refuse it.
They will actually further reduce their intake. Yeah, correct. And then so if they really cannot tolerate with all these food fortifications, then we will suggest they go for the oral nutritional supplements. Yeah, it is supplements, comes in ready to drinks or powdered form, which contains the macronutrients such as carbs, proteins, and fats, and also micronutrients such as vitamin and minerals to supplement them, to provide them additional supplements in their daily diet. And then also, besides in terms of the diet, the food, we can also modify the surrounding, the eating environment. Their study shows that eating environment will actually influence their intake as well. So we try to make the eating environment calm. Then avoid any distraction like from televisions or any gadgets, so that they can focus on the food. And then also like try to make the setting simple and not complicated. And then putting the food in different color of the plates. Like this is actually important for those with dementia, because they are actually having the loss of ability to differentiate the food and also the plate. So we make the food and the plate color in contrast, so that they can actually recognize that is the food. Prevent any confusions. And also it's important to stay hydrated, because the types of food that we can actually give them, besides giving their hydration, can also at the same time giving them some nutrients such as milk, also juice. These are the foods that we can help them to stay hydrated.
So those tips are diet, supplements that could help, and also stay hydrated lah. I believe everyone, even if with the same medical condition of dementia, right? Every body requires nutrients a different way. So it is really best to seek professional help from dietitian to advise what is suitable for that patient, right, or that person, right? Okay. Thank you, Shin Hwa, for sharing your nuggets of information with us. And I believe those who are listening get to have a better insight as well when it comes to malnutrition in elderlies. So before we go, just want to put a disclaimer out there. The health information is provided for general informational and educational purposes only, and is not a substitute for professional health advice. So to seek further medical advice for your medical condition, do consult your doctor or go to the nearest healthcare institution to get assistance. This video only represents the speaker's view on malnutrition in elderly. Thank you again, and stay safe, Shin Hwa.
Stay safe.